My name is Richard Memmott. I work for Intermountain Healthcare in Salt Lake City, Utah, and my title is System Administrator for Risk Management and Office of Patient Experience. Intermountain Healthcare is in the Wasatch Front of Utah, Idaho, and Nevada. My role there as System Administrator is to work with risk management, legal, safety and security, and also Office of Patient Experience, which handles patient safety and patient coach situations. My biggest function is the rollout and implementation of Riskonnect. Well, our previous solution was an internal developed solution, so it was kind of like my little baby. And so I had worked there for 15 years. We developed that. I had an IT staff that worked behind me. The biggest challenges of an internal built solution is maintaining that continuity with your IT staff and also further development. It seemed like everything that when single solution questions came in, you'd have to work up a development team, you'd have to develop a solution package and then roll that out and have training and all of that entailed. So it was quite a big challenge. So we didn't change the app as frequently as we could. So things became stale or stagnant to where the marketplace was moving. And thus Riskonnect came in and resolved a lot of that solution for us. Also took all that hardware, because we had to maintain servers, all of those other things, took all that solution away from us. So Riskonnect came in and they resolved a lot of those developmental issues that we had. It brings a solution that me as a system administrator can resolve without having to go to IT development staff. I can spin up a new view for a manager that's very specific and custom to just that one individual. Whereas before it was a one solution for all. Risk management can be very customized, Riskonnect can be very customized to that specific manager, executive, whatever level is confronted with the question that comes to me as system administrator. So in that way, it has resolved a myriad of problems that I was having with the self-developed solution. We use the products of ClearSight, and that entails claim administration and also incident for our patient safety team. We also have policy management in there, and we have credentialing. So we do, with credentialing, I mean physician admin, I think is your tool, with intake being the front end solution for people that respond. We use it for all lines of insurance except for workers' comp. Me personally, I love system admin, but my users especially love the views. The fact that they can go in and they can create a custom view, and they can then transfer that view to their dashboard so that they can see exactly a specific piece. If they're tracking, now being in healthcare, they're going to track specific surgery cases, specific types of incidents that they're very behavioral health issues, workplace violence issues. They can build their own views depending upon their use, and then expand upon that so they can drive right in and hone right into their issues and corrective actions. So as far as results with Riskonnect, we've had phenomenal results, mainly in the sense that people are using our solution, are coming to the table. And with that, we have been able to reduce our time frame for corrective actions. We are now meeting less than 7-day mark on our solution results with complaints. We're able to track that, so we know when we have an outlier, and we know where we need to put issues and efforts to correct or work with those individuals that have a really big case. We've also been able to bring physicians to solution resolution. So what I mean by that, with bringing a physician to the case, being that it's in healthcare, our issues need to be looked at from a medical standpoint, and whether or not the case was correctly managed, the incident was correctly managed by the physician, and Riskonnect has made it possible for us to reach those physicians and bring them to the table for our root cause analysis, for our care reviews, and those have all increased in speed. We've been able to reduce the time lag to get those care reviews done. Future plan is to roll out to all lines of insurance. We also have future plans to expand into GRC and other areas to see if we can help other aspects of the corporation which are currently not using the product. Learning and seeing what's available, talking to clients here at the conference has really shown me that there's a lot more to the package that we aren't currently using today. Keys to success is really centered around your stakeholders. Knowing who your stakeholders are and then holding them to a timeline. I think if you allow your stakeholders to continue to brainstorm and dream, which the solution allows you to do because there's lots of flexibility within the solution, can run into pitfalls. But if you can hone them into what's the core product, what's the core solution that you want to, results that they're looking for, and really look for those results, and then prepare an application that will create those results, you'll have success. It's great to work with Riskonnect. Riskonnect comes to the table as a partner and as a team member. And so as you have a solution or you have an issue that you're trying to work through, you can pull in Riskonnect, who has industry-wide, not just healthcare industry, but other industries we're not alone. And lots of people have done other issues, and they can collaborate with us to make a solution. That's been the best part of working with Riskonnect. Those in the industry with similar issues such as homegrown solutions or solutions that have aged and kind of expired their life need to look to innovative companies such as Riskonnect to bring home an application that will quickly resolve questions and answers and also be customized to meet your specific needs and also the needs of all of your customers within your industry, within your company. My hat's off and thanks to Riskonnect for coming to the table and helping us through solution finding. We've been with Riskonnect for 18 months go live and 18 months prior to that in implementation, and all the way through the steps of success have been there. The success team is there with us today and listens to our questions and brings the right folks to the table when we have concerns. And I appreciate that very much.